everyone, my name is Karen. I am the Marketing Manager for Patient Concierge Services, and we also have a private Facebook group called STAR for Surgical Transformation and Aesthetic Rejuvenation. And today we have the amazing surgeon Dr. Wara, who works at BIMC Hospital in Nusa Dua, and we're just going to learn a little bit more about you and what you do, and just have a bit of a chat. So how long have you been working here?
So actually, I'm a board certified plastic surgeon. I'm Dr. Wara, also a consultant of craniomaxillofacial. So basically, I just work from this year.
Just this year for 2025.
Yeah,
amazing. So you must be pretty excited.
Yeah, I'm pretty excited.
So we'd love to learn a little bit about you and not just being a surgeon. So would it be okay to ask you, are there anything that you can't live without? So for example, I cannot live without chocolate, red wine, cats, kuching, and my phone. I have a terrible addiction to my phone. I wake up in the morning and I am like, where's my phone? It's terrible.
Same for me also.
Yeah, you're the same?
Yeah. So basically for me that I most favorite is like music. I cannot...
You love music?
Yeah, I love music.
Yeah? What type of music do you like to listen to?
So maybe like a pop or jazzy music.
Pop and jazz. Yeah. Nice. Do you like to dance?
I don't think so.
You don't think so? I know, sometimes I try to dance, especially if a man tries to dance with me and then I turn into a tree. Maybe we could be two trees. Great. So would you say that you have like a speciality of working here as a surgeon?
So actually, I'm a plastic surgeon, and I'm a consultant of craniomaxillofacial.
Could you say that again? Sorry,
a consultant of craniomaxillofacial.
Could you explain that to me like I'm a 2-year-old?
Okay. So as a plastic surgeon, we have like a subspecialty.
Subspecialty,
as a general one, not only for the cosmetic one. So we have like a reconstructive and also for the aesthetic one.
So reconstructive, would that be for somebody who maybe had an accident?
Yeah, so like a trauma or there's a wound because of the accident or tumor or anything. So actually plastic surgery is not all about cosmetics. So we, especially in Indonesia, so a lot of traffic accidents. So
of course, on motorbikes
handle the trauma cases. And for my subspecialty for the craniomaxillofacial, it actually deals with the bone and structure in our face, especially either with the reconstructive one, like there is a fracture in our facial bone, and also there's like a congenital abnormalities or something like that.
I understand, So Santi, the owner of Patient Concierge Services, used to work with Dr. Suka with the children, you know, who had cleft palate. So that would be considered reconstructive.
Reconstructive.
I see. So you must know a lot about the face and how the face works with the bone. And if somebody had an accident and your goal was to return it back to looking normal or something, is that what?
So our goal is to looking normal with normal function.
With normal function, like in terms of how the muscle moves and that kind of stuff. Okay. Well, if you're an expert at looking after people when they've had an accident, I think you must be even more of an expert when a lady comes to you and says, "I think I'm ready for a facelift." Can you do reconstructive surgery so that I look 10, 20 years younger? Would that be a fair observation?
Yeah, maybe.
Have you done many facelifts for women?
So actually, we done here a lot of facelifts.
You've done quite a lot of facelifts. And is there like a certain technique that you prefer other than any other?
So actually there are a lot of type of facelift, and there are a lot of language that maybe a little bit confusing. A lot of type like mini facelift.
I'm so confused.
So basically, so we have to know what is the facelift actually. The good facelift is not only tighten the skin, but the inside structure of the face.
Inside structure.
The main important thing that we have to know in aging process, especially because there are like a strong bands.
Strong bands.
Like we call it a returning ligaments.
It's what do you call it? Sorry.
Returning ligaments. Ligaments of the face. And it's like connect the deeper structure of our face from the bone.
Is that what deep plane means?
Yeah, actually.
Okay.
So actually, it's like all of the type of the facelift actually address that way. As we age, so the ligament is weaken.
Like the elasticity becomes less?
Yeah, less. Okay. And it make our skin sagging.
Okay.
Yeah. So all of the type of the facelift procedure is address the ligaments.
Okay.
So either just only to tighten that up, only tighten. And also we can cut all the ligaments and tighten this one.
Okay. So just so I can educate myself, because I think maybe I will get a facelift in the next 5 years. So I think I know a mini facelift.
Okay.
Would that be considered just like lower and maybe only the SMAS and not the ligaments, or?
Okay. Actually,
tell me the difference.
All of the type of the facelift have a manipulation of the ligaments.
All have manipulation of the ligaments. Okay, this is good to know.
Yeah. So basically, maybe the common procedure that we know is the SMAS facelift. Yeah.
What does SMAS stand for?
So actually, SMAS is like a muscle of our faces.
Muscles.
Yeah.
Okay.
So in our face, the muscle is not that obvious, like this is muscle, but it's like a combination of the fat and also like a soft tissue. So we cannot differentiate it like in other part of our body. It's just clearly the muscle, but in our face it's just like a mix of soft tissue. So
okay. So it's a mixture of the muscle, the ligament, and the soft tissue.
Yeah.
When patients come to us and they say, is it just the skin that gets lifted in a facelift? And I say, no, from what I have learned from the doctors, they go inside and they, even if it's like a mini facelift, which Dr. Ashley does at New Look, or if it's a deep plane facelift, like what you would do or Dr. Suka would do, I think, imagine like making your bed in the morning. You have to make the sheet first and then the top cover.
It's like that. Yeah. So actually, if we only tighten the skin, so it may be temporary, so it looks good, but as gradually it will last. And also the scar will be not good. Yeah, because only the skin that will tighten, but inside of it, the ligament is still there.
I see. Yeah. Would you say maybe like 20 years ago they would only do the skin, and then maybe like did they just learn from the mistake, and then they said, oh no, we have to go in and pick up the muscle and the ligament too?
Yeah. Already developed from a long time ago. So the first time the surgeon only tightened the skin only, but after the surgery it looks good. Yeah. But actually gradually it will look, sagging will just and also the scar will be very noticeable because it's very tension, the tight, and also there is a not natural look.
I remember seeing celebrities on TV. I don't know if you're the same. I mean, you're much younger than me, so maybe not. But I remember seeing celebrities on TV, and they just looked like they'd had their head out of the car window.
It's like a pulled appearance, like something like that.
Yeah, and I guess if they didn't pick up the muscle and the ligament, and it was just the skin, it's a lot of weight for the skin to then hold the muscle that is still dropping with gravity, I guess. So how would you describe the difference between a mini facelift and a full deep plane facelift? Okay,
actually, so for the term of mini facelift, usually is the definition is only just for the face usually. So usually for the mini facelift, we don't address the deeper structure. So we just tighten the SMAS layer.
So is that like where you use stitching?
Stitches on the muscle, but not cut the ligaments. You just tighten the muscle inside of it.
So they don't cut the ligaments. That's the main difference. I see. So would a mini facelift be more applicable for somebody like in their late 40s maybe?
Maybe in younger
who just wanted like a bit of a freshen up. And would there be less opportunity for the neck to be lifted?
So I think with the mini facelift, we just address this one.
Just this
and cannot address the neck laxity.
So if somebody was to get a full deep plane facelift, how does it affect the neck?
So actually, as we age, also not only the face, but also the neck. Also, there's a sagging of this neck. Sometimes there's like a neck bend. And also, so if we perform the full deep plane face and neck lift, it can tighten our excess skin in the neck.
I see.
And also can make it like more refresh the neck.
Refresh the neck as well. And I've been learning as well that like 20 years ago they would go this way, whereas now you go this way. Is it like vertical?
It's quite like a vertical one.
Or like on an angle maybe?
On an angle.
I see. Okay.
So actually why I want to become a plastic surgeon. So for me, when I first know what type of the procedure that the plastic surgeon do is very different with other surgeon. So it's like there are not only skill and also knowledge that needed to make a good result.
Yeah.
So for the plastic surgeon, is need also art aspect.
Art.
Yeah.
Ooh,
yeah.
Tell me more. I like this.
So like all of the procedure that we are done, so need our art aspect. So we have to know what is the design of the operation. So we have to make sure that we know how we can make the transformation good to the patient, either for the reconstructive and also for the cosmetic procedure. So for me, it's quite because it's quite interesting. And also when I want to go there, I want to pursue residency in the plastic surgeon. So they test me to draw.
To draw?
Draw.
Yeah?
Yeah, it's very, it's quite unique.
I didn't know you had to draw.
Yeah. So for me, it's one of the kind that, it's very unique. It's different with other surgeons. So we have a test to draw the face and also draw the object near us. So it's quite different because I understand why that is needed. So as a plastic surgeon, we will draw a lot of design of the operation before the operation. So it's like when we do the facelifts, so we have to know how to design the proper design to the incision.
I see.
And also if we want to do another cosmetic process, so we have to know the design. So the design is the most important part of the surgery in the plastic surgeon, because we cannot cut like just
has to be accurate.
Yeah, it has to be accurate and delicate. So the design is very important. So for me, and also in the plastic surgeon, it can make like a transformation.
A transformation. Yeah.
For me, the transformation is not only just outside for the physical appearance, but it can make like life changing for the person that transform. So for me, so
I
that's
love
why
that answer. It's not just the outer transformation, it's the inner transformation, and I wholeheartedly know exactly what you mean. We have the most wonderful women coming to us, and they've spent all of their life looking after their children or their grandchildren, and sadly they've not been able to look in the mirror without criticizing themselves for quite a while, and then they'll have some surgery, whether it be upper bleph or a facelift or something on their body, and they are just like a new person. They are shining, they are happy, they are more confident. One lady said, I feel like I've been reborn.
Yeah.
I know, isn't that so good?
It's like transformation. It is really transformation.
Yeah, and I just think, why not? People invest money in making their car look nice, their motorbike, their house, their clothes. What about our meat suit? And sometimes when I watch the surgeons work and they come up with their magic pen and they're drawing all over the patient, I think it's a bit like a dressmaker.
Yeah. Quite a bit.
A little bit like with the skin, And not, like you say, the transformation has a long-lasting inner effect on like their self-esteem and their confidence and the way they interact with other people and the way they go about their life. Can you think of an experience that you've had where the patient that you'll think, I will never forget that because it was so rewarding for you?
Okay. So actually I have one patient.
Yes.
So she has like a lot of aging in her face, and also before the surgery, so she like smoke a lot.
She was smoking
a lot. So in that time, so she decided to undergo a plastic surgery. So
what did she have? A facelift?
So a facelift.
A facelift, yeah.
So the result is like it really can tighten her jaw and also make it our jaw is more defined. And also especially in her neck also can make it like more refreshed. And after that, she is very happy with the result. And the most important one, so before the surgery, I just tell her that, so I can do the surgery if you maybe a little bit reduce the smoking. So because the smoking can...
Did you have to stop smoking before surgery for like 2 weeks,
Actually.
Or 4?
Actually like it's ideally for the 2 weeks. So she say for me, it's very a little bit difficult, but I will try my best. So, and after the surgery, so how about your smoking? So she really stopped the smoking.
She stopped smoking?
It's very, and for me it's like, I'm quite surprised. So I think can you do it? Oh yeah, I can do it.
That's fantastic.
So I feel not only my appearance, but also it's really changed my life. So yeah, I try to not smoke again. Yeah, it's very, for me, it's not for the result, only for the appearance, but also she can change also her
she stopped a bad habit.
And she's really feel happy about it.
Do you think her decision to stop smoking was because she was so happy with the result of the facelift?
I think it's one of
she wanted to maintain that for longer.
For a longer time.
That makes sense. If there was somebody watching this who really wants to get cosmetic surgery, whatever it may be, a facelift, bleph, something on their body, and they're just so nervous, is there anything that you could say that might make them feel more relaxed or at peace with doing it?
So actually, you are in a good hand.
You're in good hands. That's good.
So we are here as one of the center of the cosmetic surgery. So we will try to prepare the patient first. So we have to check all of her general condition, health condition, and also we try to not to change her to become a different person.
Yes.
So here, for us here, so we believe that the good transformation is how we can reveal the best version of ourselves.
Oh, that's beautiful. I love that.
So not to change to different person. So I know that it must be a little bit nervous. We will assure to make it patient happy. I think that's really reassuring. I think one of the patterns that I've noticed with our patients is they make the decision to have the surgery, but because it's not linked to a health concern, they sometimes experience a little bit of guilt or shame or confusion. They say, oh my God, why am I doing this? I'm going to have anesthetic. There's maybe like a small risk. And they sometimes don't tell anybody. Like they do it in secret. And then, of course, if you're in isolation, then you feel even more worried or anxious. So part of our service is to say, you can celebrate this. This is like a really great thing that you're giving to yourself. It's like a journey, right?
It's a journey. But for some reason I think there's a little bit of a stigma in society, that we maybe need to push back against, because the media still only ever publicise the botch jobs. They don't talk about the good jobs. So sometimes if somebody tells, say, their husband or their friend, they're like, oh, why are you doing that? You don't need it. Please don't do it. But listening to what you've just said, the risk is very, very small because you check all of their health. You check the heart, you check the lungs, you check they're in good, stable health condition, and actually you're not looking to make them look like a different person. You're just looking to do like an enhancement and a refresh.
It's like to become a best version of yourself, maybe younger.
You
look younger, but maybe everyone will look at you, what is different? Why you look different? It's not different person, but I
think that's the key. Is like you want to walk into the room and people go, "Wow, you look great," but I don't know what it is.
So my patient also said to me that she experienced that
the same reaction.
So she said that only. Oh, I just eat nutritious food and I do this exercise. But she's very happy. What is different? What is skincare that you use?
What's skincare? I gotta buy that cream.
So good surgery is how to make it a natural look.
It's natural. I had one lady who we looked after and she didn't tell her husband. She told her husband she was going on a yoga retreat. And then when he picked her up at the airport, he was like, damn, you look good. You look like how you looked when I first met you. I think she told him eventually. But I think that is the goal, is to keep it looking natural and very beautiful. Nobody wants to look like they've had surgery. Is there anything else that you would like to talk about?
So here we will do a lot of stuff of cosmetic surgery. Not only for the facelift, not only our face, but we do all of the cosmetic procedure in your body, like a tummy tuck, mummy makeover surgery.
Mummy makeover. What's a mummy makeover for those who are watching that don't know what it means?
It's like when we are as a mommy. Yeah.
Yes.
So we have children that because of that, and also for aging process, it can make like there's an excess skin in our body. So with the mommy makeover, it can remove the excess of the skin, like a tummy tuck procedure, and also lift maybe for the breast lifting or like a breast augmentation that make the mommy feel younger.
So usually it means like multiple surgeries in the one appointment. Like so breasts and tummy at the same time?
Sometimes it can happen in one operation. Usually this depends on the patient condition and patient preference.
I see, yeah. Okay. So a mummy makeover. Isn't that lovely? It's like, a makeover for mummy. And so we're at the beginning of 2025. Imagine it's at the end of 2025. What would you hope to be talking about that you have achieved here at BIMC?
So I hope that I can bring a lot of happiness to our patients. Because it's very rewarding also for the surgeon that can our patient is happy, make surgeon happy too. So I hope that in this year we will bring a lot of happiness to a lot of patients.
That's beautiful. Thank you so much. Okay, thank you. That's a wrap. Thank you so much.